Hi, my name is Grace Williams, and this is for my nursing project. For my first section, I am going to be taking my patient's temperature. This is Eleanor Williams, my sister. So this is a new thermometer, just bought, and I'm wearing gloves for protection against infections or just sanitation-wise, and also making sure I have long sleeves for that as well, so nothing gets under my skin and could cause contamination, as well as for my patient. So we're gonna just have you lift up your mouth, and I'm gonna slide that in, and I want you to put your tongue right over. Can you hold that right in place? A normal temperature is around 98.6, so we want to make sure that we're around that. Obviously, it doesn't have to be exact, but pushing 190, 99 is fine, but 100 or over can be cause for like a fever, and below could be potentially hypothermia. Okay, and her temperature is 99.1. Roughly around 98.6. That's about 5 off, but that's okay. And yeah. Okay. Hi, this is Nurse Grace Williams, back again with my patient Eleanor, and today we're going to be taking her pulse. So some of the things we want to remember is, of course, keeping our gloves on. Of course, in certain circumstances where there isn't a lot of time and you just have to figure out where, find their pulse to make sure that they're alive and breathing, then of course you have to think about like maybe doing that more than just getting on your gloves. But for this scenario, we're going to be keeping our gloves on. And the way I'm going to do it is I'm going to be taking her right hand and putting my pointer and middle finger right above her larger vein in front of her thumb muscle that leads down, and that's where a lot of her blood supply is going to be going, and that's how you're going to be able to easily find her pulse. And another easy way to find it is right behind like right underneath your jawline in front of your ear, also using that 2 fingers, but she feels a little bit more comfortable with her arm. So we're going to go ahead and get started, and we're going to be doing this for 30 seconds, and then I'll be timing that by 2 to figure out how many pulse she has in a minute. So let's go ahead and get started. And I got 42, so that's going to be 84 pulse per minute. And I'm just going to record that in my notes. A ton of the nurses usually have a notepad or just a way of putting it into the computer. But I'm just going to be using this notebook where I put in 42 times 2. Cut. 1. Go. Nurse Grace back again, and we have Eleanor Williams as our patient again for the 3rd time. And we are going to be checking her breathing per minute. And I'm going to be checking that based on the rise and fall of her chest and shoulders. And I'm not going to be asking her to take deep breaths because that could change our results for how many breaths she takes per minute. And doing the pulse, I did times it by 2 when I took it for 30 seconds. But for this one, I'm not exactly sure what type of breathing she'll be doing, if it'll be irregular based on how she feels in the nurse's office, because you know there is such thing as a white coat syndrome where you get a little bit nervous in the doctor's office. So we're going to be taking it just through a minute, and we'll see. So I'm going to go ahead and track that in my notes, but we're going to have a timer for a minute, and we're going to be watching the rise and fall of her chest. 3, 2, 1. we got about 27 breaths per minute. And I was able to record that by the fact that she had a pretty regular movement of breathing, and she would be taking very solid, very pattern-based breaths. And we were able to see how her both her chest but also her shoulders was, and then when she exhaled, they both fell down. Thank you. Grace Williams here again, and we're gonna be safely transporting her from this couch to this couch. And of course, with different patients, it all depends on what they have had done, if they have had a surgery, if they have a medical condition that caused them issues to walk, if they're just weak in general from being sick. There's so many different ways that a person's walking can be affected, old age, just many different things. And we want to make sure as nurses that we're able to move them safely and be able to support them without being hurt ourselves, because of course if they put too much of their body weight on us, some things could happen to our backs and arms, and that's also not safe nurse practice. So we're gonna have you stand up. I'm gonna grab her hand to help support her, and I'm gonna grab her back to make sure that I'm holding on, and we're gonna slowly walk, going pace by pace based on how far she wants to go. And I'm making sure that I'm not holding on too tight, but that I have a firm grip on her. And when she wants to turn around, I will turn around with her, and we're gonna slowly go down, and we're gonna make sure. And of course, if she had an issue where it was the bed, then we'd lay her down, which we can show you if you'd like to stand up, please. Thank you. We're just gonna lay you down as such, and we're gonna have your feet go up, this, and then she'd lay back, and there we go. Some of the things we want to remember is going pace by pace based on the patient, because that is of course of sincere importance. You don't want to rush them based on their pain tolerance, how weak they're feeling. They might not even be able to get up unless they need support from a stretcher or just being moved by bed. It's all about where the patient is at in their healthcare journey, and we want to be there to support them as nurses. So, Grace Williams back here again, and after a long day, of course, maybe going to the bathroom, you can be putting your gloves away, and of course having to wash your hands. And washing hands is of great importance, especially working in the hospital and medical field, because of course you're working with a lot of patients. So one big thing is you're gonna want to lather your hands up in soap. I'm just using the Citrus liquid hand soap, and I rub that in, and then put in the water, and just start massaging the soap in my hands, getting all the germs off. And you want to be counting for about 20 seconds. So I just count to 20, or I sing ABC. So and you're going to want to rinse it off. Make sure you rinse all the soap off your hands. You want to turn that off, and of course take your towel. Otherwise there will be paper towels in the bathroom for you. But there we go.